Okay, right, so let's make a start. So good evening, ladies and gentlemen, and welcome to the Adult Health and Social Care Scrutiny Board on Thursday, the 20th of August, on this very, very sunny day. So let's continue. So welcome, everybody. So substitutes nominated for this meeting and apologies for absence. I have apologies from Councillor Naeem and no substitutes nominated for this particular meeting. Item number 2, members' interests. Just to remind members to declare the relevant interests at the relevant times. Item 3 is admissions to the public. The public are most welcome to view on YouTube and listen to what we have to say this evening with great interest. So it leads on to item number 4. The minutes of the Adults Health and Social Care Scrutiny Board held on the 16th of July 2020. May I just say, first of all, Carol, they are absolutely fantastic, absolute set of minutes there, and it was absolutely a pleasure to actually see them. And it was really important because actually people from the public want to see the essence of what the meeting was all about, and you could really grasp what that was about. So thank you, Carol. It does mean that there might be more scrutiny on them, but they're spot on. So thank you, Carol, for that. So do we have members in favour of those minutes? You show, yeah, super. Thank you, Councillor Hutchinson. And a seconder just on that one. Anyone? Yeah, thank you, Councillor Barnes. So we'll approve those and move on swiftly. So say once again, thank you, Carol. Keep up the good work. So thank you. Okay, so item number 5 is our regular COVID briefing. So Deborah, would you like to start off as to give us the highlights? I think we've had quite a number of these meetings. I think it's going through the latest developments, you know, what the next steps are, and hopefully give a bit more meat on the bone. So over to you, Deborah, first of all. Thank you.
Well, thank you, Chair. So I think if it's okay, Chair, I'll start with just a little bit about the current situation, and then I'll say a little bit about some of the developments that are in place, that have come into place recently, some of the things we're doing. So I've got my notes here. Apologies for looking away, but just while I get the exact figures. So as you'll recall, we use a rate, a 7-day average rate per 100,000. As an indicator of the infection rate in the borough, and that's the rate that we track. And when towards the end of June, when the borough was when we came out of the national lockdown, our rate was around 10 per 100,000, and our rate went up to almost 50. Was the highest that we've had. It just 49 point something. Very probably last week. Which was the highest it has been since we came out of the national lockdown, and we were started to be able to sort of look at this data in this way. The rate at the moment, the 7-day rate as of for the 7 days up to the 17th of August was 35.7. Now there's just a few things I need to say about that. I think the first thing I need to say is that unfortunately we are having some test results that are taking a greater proportion of test results are taking longer to get through than previously. So that figure that I've given you may change if people's test results are 4 days or 5 days. That figure may change. That equates to 75 cases in that 7-day period. The week before we had 90 cases in the week. So bearing in mind it might creep up because we might get some test results coming through. But what I think we are starting to see is a stabilisation in the rate. Now we saw a very rapid increase, and I've been here before and we've talked about a very rapid increase. That increase has slowed and it seems to be stabilising. Now we would want to see this pattern, Chair, probably for 2 weeks before we could be confident that it was a trend rather than you know, just a particular for another reason, just by chance, not statistically significant change. But it does appear that rate is starting to stabilise, and obviously the sort of 35.7 is significantly lower than 50. Which it was. So we're hoping that the local restrictions that we've got in place, they've been in place now for 3 weeks, we're hoping that that's starting to show an impact on that and stabilising the rate in the borough. Then I'd just like to say a little bit about the cases and what we know about the cases, just overall, some of the patterns that we're seeing. We were fifth in England last week, and I think we're either 9th or 10th at the moment. So again, we're moving down the league table that no one wants to be top of at the moment. What we're seeing in terms of some of the patterns is we are actually seeing as we've been seeing for a little while, that the majority of the cases, but significantly actually, are in working age people, and actually in the younger end of working age people. And that's one of the reasons that we're not seeing the levels of hospitalisation that we were seeing earlier in the pandemic. So the biggest increase that we've seen over the last couple of weeks have been in people aged 18 to 34. And then the next biggest increase is the people sort of the sort of 34 to 50 sort of age group. We've seen a reduction in under 18s, but obviously we know, don't we, that as people interact with each other, that we will potentially see increases in cases in younger people when the schools go back. And our role is going to be really keep a real contain that as quickly as possible. And I'll come on to some of the things we're doing for that reason. And we've actually had a reduction in the proportion of cases that are in an Asian ethnicity. So previously, the majority of the cases, sort of about 60, about 2/3, 60, 66, 65% of the cases were in people of Asian ethnicity. We're actually seeing a reduction now, and it's just under 50% of the cases that are in people of Asian ethnicity. One other thing, oh yes, that's the other thing. We are doing a lot of testing, and we have really increased the amount of testing that we've been doing, and do have one of the highest rates of testing in the region. Just in the last week or so, despite us having the testing available, we've seen a bit of a reduction. Still very high levels of testing compared to what we were doing, but we have seen a little bit of a reduction in the testing. This is something that other areas have seen, where they've been under a lot of media scrutiny, under a lot of national scrutiny. They have seen a reduction, and some of the explanation of that is people feeling stigmatised and feeling that potentially, that they may struggle if they are tested to isolate, and some of the challenges I think that come with testing positive. And again, we're doing a lot of testing. I don't want to unduly worry you about that, but it might be the beginning of a pattern where we're seeing people being less likely to take up testing. And then the next thing I want to say, really, if it's okay, Chair, is just a little bit about the action that we've been taking. So since the borough went into the local restrictions, we've developed a very high level strategy, very simple actually strategy, that all the partners in the borough have signed up to. That's very much about preventing transmission of the virus, about identifying people that got the virus quickly as possible, and then finally around really containing the virus. And the things that we're doing, the actions that we're taking are around engaging with the public and with the community, getting really simple messages out to the public. We're also, in terms of the prevention, in terms of the identifying, we've already talked about the testing work that we're doing, and we've made some real developments in testing in the borough, in that now really there's lots of choices about how people can get tested. They can go to a regional drive-in centre. There are mobile testing units right across the borough now that people can either walk up to or drive to. We have testing that people can have. They can request to have it sent to the home and post the test back and do a self-swab. And they can also go to quite an innovative testing site that's based in Asda, that's being jointly run with the local community, so that it's welcoming to the local community. So testing's very widely available and lots of choices about how people can get tested. And then the other really key thing that we're doing is local contact tracing. And I just, if it's okay, just want to say a little bit about this, because Calderdale is one of the first places in the country to do this local contact tracing. And I think it's really important that members of the Scrutiny Board understand that this is a very, very strong partnership between the council and our local partners and the government and the National Test and Trace Service. So this is a hand-in-hand service with the National Test and Trace Service. And what happens is we've actually got 26 people trained up as local contact tracers. And what happens is that we receive information of cases, so people that have tested positive, where the National Test and Trace Service hasn't managed to reach them in 24 hours and hasn't managed to reach them and identify their contacts and make contact with them. That started on Wednesday, so yesterday. So we launched it. We got the go-ahead on Friday. There's some technological IT systems that happened over the weekend, and we started to get our first cases through. So thought I might give you just a little bit of just a little bit of where we're up to with that. It's really important because by identifying the people that have been exposed to the virus or at risk of being exposed to the virus, by supporting them to isolate and separate from everybody else, this is a really important way that we will bring this, the rates down to the national average and hopefully get our freedoms back. So the first thing I just wanted to say a little bit about is that we had a bit of intelligence that there may be an outbreak in the setting, our local contact tracers followed through that setting, did some investigative work with the contacts, with the cases, and we're able to get very detailed information actually very quickly. And actually identified that informed the risk assessment and the work that setting did, actually identified that there had been an outbreak that had happened previously, actually, that we hadn't known about until we did the contact tracing. We were able to give advice and support to the setting to put measures in place to reduce the chance of an outbreak like that happening again. I know our colleagues in Public Health England and others in the outbreak management team were so impressed with how quickly our contact tracers got that information, and also with the level of detail of the information that they got. And then today, just to give you a sense of this, we've had 3 cases come through today to the team, and the team are currently actually working on contacting those cases and following up the contacts. The team works on 2 shifts each day, so 9:30 till 2:30, and then 2 o'clock till 7 o'clock with the handover period in the middle of the day. So I just thought that would bring that to life a little bit, the contact tracing to life. And then I think the final thing I'd say is just about the work that we're doing with enforcement. We're working really hard to follow up reports of non-compliance with the restrictions, following up intelligence, working really, really hard actually right across the council and our police colleagues to do that. And also, but to do more proactive work with settings as well. So we've got 21 high-risk businesses that we've been working with and visited, and offering support and advice to them to try and prevent outbreaks actually happening. And equally, working with schools at the moment through our children's services, working with head teachers and with schools and school nurses to support schools to reopen. And as I said earlier, what's going to be really important is that the two things really: the COVID secure practices are put in place in the schools, and the schools are ready to implement those. But secondly, if we do get any cases, any children or any staff members, we can get people tested really quickly, isolate that bubble and contain any outbreaks that happen as quickly as we can. In a similar way, actually, I'm sure Ian will come on to this, in a similar way actually to the we're doing with care homes. So that's all I wanted to update you on, Chair. I hope that's been useful.
No, thank you very much. We've got a few people indicating to speak so far. So Councillor Megan Swift, if you'd like to ask your question, please.
Yes, thank you. It's very much the time, I think, that things get back, and I was giving support from a distance to somebody who waited over a week to find out whether it was positive or negative. Now, really good, it was negative, but they had to wait for a week. They don't drive and they hadn't a car. It just got very silly getting them there. And I wondered, you can't just walk up to either the Mixenden one or the fire station ones, can you?
What you can do, Councillor Swift, is you when you book on to the national portal, if you book on, you can explain how you intend to get there, whether you will be walking or driving. And you should be, if there's a slot for you, you should be able to walk up. The site that we've got up at Asda is really about reaching people that otherwise may find it difficult to access. So there are some slots available for people that are unable to book on because they don't have access to the internet, and people that can just walk up because they're unable to book on. Obviously, ideally, people book on and they can access the internet. That's the best way to do it. But you shouldn't have to drive anymore. It shouldn't just be drive-through testing anymore. But I think your point is really important about the testing. There are, I've heard of someone who got the test results within like 12 hours. So some of it's really quickly, but we are hearing quite a number of reports, unfortunately, about tests that are taken. I have heard a number of examples where test results were a week in coming through. I think it's a minority, but it is something that's happening, and it's due to capacity in labs, is my understanding. It's the capacity in laboratories, and I do know from a conversation I was on earlier today that the Department of Health and Social Care are looking to further increase the capacity of labs to enable more testing to be done and more quickly the results turned around. Okay, thanks, Dave.
Okay, thank you, Councillor Barnes.
Actually, my question was answered, but in about that last 15 seconds, actually, from what Deborah said. However, just point of clarity, when you mentioned about the outbreak that we hadn't identified, are you saying that was the data that came nationally didn't identify that outbreak, but we identified it locally? Is that what you were saying? That's just clarity on that point.
Yeah, so what we got some, we were always clear that with the local contact tracing, there'd be two ways of us getting information. One way would be for the people that from the national team that they haven't managed to reach within 24 hours. But we were always also clear that we would get insight or local intelligence or information maybe locally, where we'd need investigators, like contact tracers, to look into it and investigate. And the example that I gave that related to the setting was in that sort of that second category. So it was we knew there was some cases, and we didn't know whether the cases, the transmission of the cases, we didn't know whether that had happened in the setting or had happened in the community, if that makes sense. And our contact tracers asked questions, gathered quite a lot of information, and they were able to show and find out that it had actually happened, or the chances are, we never know for sure, but that the chances are that the actual transmission had happened within the setting as opposed to within the community, if that makes sense.
Okay, so you're talking about CSI Calderdale then, are you, Deborah? Yeah. Thank you, Chair. Thank you, Deborah.
Excellent. Councillor Lee, please.
Thank you, Chair. Debs, first of all, I thought your analogy to Typhoid Mary in New York was quite apposite today. And I want to talk about that general theme and eventually get to enforcement, because, as you know, Typhoid Mary didn't know she was suffering in the way she was. And a lot of people don't know the suffering from COVID. And so it is a great analogy, because if people suffering from COVID don't follow the guidelines, then we have a problem, a Typhoid Mary type problem. And in the circumstances, one would expect that people in our borough would be exemplary about this. And in fact, there are many reports that that is not the case. I mean, just nationally, on national TV, we can see that in general, a lot of people are not social distancing. They're getting on with their lives. It's understandable the frustration that's being felt, but the fact is they're not doing it. And we've had some reports this week, you'll be aware of them, I'm sure, about one major supermarket in particular, but I'm sure this applies in the round. You know, are not observing the social distancing and the rules that we are supposed to be following. And it's very, very disappointing that that should be the case. In my own local convenience store, the owner told me that about 30% at least of people are not observing the mask. And, you know, I'm sure we'll all feel the same about this. If you go in a shop wearing a mask, observing the rules as we all do, it's quite frustrating to see that a larger proportion of people are not wearing it. So I'm afraid it has to come down to enforcement now. You know, we can't have Typhoid Marys running around. And so, is there any plan to really take a stronger hold on enforcement and absolutely ensure that if people don't want to abide by the rules, we'll take some penalty or insist that they can't go in the shops and the places where they could potentially pass this disease on?
I think it's a really, really good question, Councillor Lee, and we are getting a lot of reports about non-compliance with various elements of the restrictions, and I know the team are working incredibly hard to follow up those restrictions, to follow up that intelligence. The supermarkets, there are a number of supermarkets in the borough that we are getting a lot of complaints about. One of the things we've done is go up. I personally spoken to the managers of 2 supermarkets that we've had complaints. I've been out and visited them and spoken to them, and some of the supermarkets have national policies, and obviously we're not in a national situation in Calderdale. We've got local restrictions. So potentially those national policies may need to be adjusted in Calderdale. One of the things we've also done, so we have been and appealed to the local store managers. We have had staff outside some of the supermarkets. We've had complaints about handing out masks and talking to people and engaging them and asking them to wear masks, and that has actually you know, led to some success. And I think it's really important that we you know, we do everything we can around enforcement. At this point in the process, we're starting to see if this continues, we're starting to see our rates stabilise. We want them to continue to do that. And I think focusing on where we are able to enforce, where we have powers, you know, it's really important that we do use them. We will always take an approach that is where we engage first. We educate, we explain, and then ultimately we will enforce, and we have issued proceedings. I mean, every time I say this number, I get told off because it's out of date. But the last time I heard the number, it was Monday, so we were a few days on since then, but it was 21, and there were 21 businesses we had actually issued proceedings against. What that involves is it involves us writing to them, explaining what we're unhappy, you know, they're breaching the regulations, and we give them an action plan, and we ask them to take action, and we tell them we'll be visiting again to see that the action's been taken. And in all but one, when we've been back, they have adhered to they've done what we asked them to do, because they can see that we have power and we will take action against them. But we have started proceedings against at least 21, it might be more than that now, businesses. And so I do really take the point, and it's really, really important that we do this. I think one of the challenges with the supermarkets is that their national policies are very concerned about discriminating against people with non-visible disabilities, and they don't want to sort of stigmatise people, and that's why often they have the policies that they've got. So as I say, we are appealing to the managers, we are handing masks out, we're doing everything that we can to sort of encourage people to wear the face coverings as much as possible, and we are ultimately taking action when we need to. And I do think it's incredibly helpful, the intelligence that we get from members about examples of where there may be non-compliance.
Excellent, thank you for that. Councillor Whittaker.
Thank you, Chair. Yeah, just on this point, I've got two questions. One's just more of a point of clarification, but just on this theme, I just want to know, Debs, what you're doing. I mean, I know the council have their own enforcement powers when it comes to businesses and not complying. However, with members of the public, I'm aware that it's more the police that should take the enforcement action. What work are you doing with them to make sure that the enforcement is applied where it's needed? And secondly, just on the local track and trace, am I right in thinking, is it government funded, the local track and trace, and does that include the staff that are working on it and all the kind of mechanism behind it?
So I'll answer the first question first. So yeah, we're working really closely with the police, and when I did my little presentation, I talked about a strategy that we developed that sets out the things that we're doing as a partnership. We all signed up to that, all the partners, so the police, the NHS, the council, the voluntary community sector, and that does include real, you know, enforcement action. I think the members of the public element of this is really difficult. It's really, really difficult in terms of the powers and the ability to use the powers is really, really difficult. And again, what usually happens is, because we use that 4 E's approach, which is engage, educate, explain, and then ultimately enforce. Usually by doing that, in a situation where we think someone's not complying, by doing that, engaging and explaining and educating, we usually don't need to do the enforce bit, because usually by the time the police and our community wardens have actually spoken to somebody, they're usually willing to you know, to moderate the behaviour. I do think there have been some challenges with the nighttime economy, where it is much more difficult, Councillor Whittaker, you know, in an evening, in a night time when people perhaps have been drinking alcohol. I think that can be a more challenging situation, but the police are really committed to us, to supporting us through the 4 E's approach to engaging with individuals. In terms of the second question, the local contact tracing service is absolutely part of the national. It's a hand in hand with the national service. So we've set it up, and we are in discussions with the government about getting the costs of that. So the staff costs, the other costs of that service. So there's while we haven't actually got the money off the government yet for the contact tracing, we understand that that's something that that we'll be able to negotiate and discuss. And all the noises that I've had have been really positive about us ultimately getting that resource. At the moment, that we're funding it out of money that the government gave us for our local outbreak plan, but because when we wrote that plan, we weren't going to be doing this local contact tracing, we didn't account for that, so we didn't include that in our plan. So we are hopeful that we'll get the additional funding from the government for the local contact tracing.
Excellent, thanks Debs. You kindly updated me in terms of a potential new testing station in Brickhouse. Can you provide members with a bit of an update as to where we are with progress on that, please?
Yeah, of course. Yeah. So we've actually identified a site in Brickhouse. So we've got 2 sites in North Halifax. We've got a site in Todmorden. We've got the one in Asda at Thrumhill. And we knew we needed one down in the Lower Valley. So we've got a site in Brickhouse, but every Wednesday morning we have a tactical health protection group, and where we look at the data. And we've actually, as yet, what we've seen is that people in that area have got quite a high testing rate, even though the testing site's not been mobilised yet. So there's one of the high areas where there's higher levels of testing. So that sort of indicates that people who want to get tested are able to get tested. What we will do, though, is if those figures start to change and it looks like the proportion of people in that area are less likely to get tested, if you see what I mean, then we'll send the mobile testing unit to the site in Brickhouse.
Good. Does that mean the people of Brickhouse can have more freedom?
So it's basically because obviously we've got a limited number of sites and a limited capacity for the testing unit, so we try and deploy it where it's needed. And at the moment, as I say, the people in the Lower Valley are doing really well on getting tested, even though they may be travelling a little bit further away to get it. But as I say, as soon as if the intelligence changes, we're ready to deploy it down to Brickhouse when that's needed.
Super. Just one other, Councillor Whittaker, yeah, another question.
Thanks, Chair. I've just thought of it earlier, then I forgot it. Debs, I just wanted to ask you about about your thoughts about having a postcode based restrictions rather than a borough-wide one, and whether it's something that the council are kind of lobbying for or think is a good idea.
I mean, I think obviously there's. I'll give a view as the Director of Public Health from a public health perspective. One of the things that there's a couple of things really. Our communities are telling us that they are still quite confused about the messages, about the restrictions, and I think there's an element of what geography would you do if you're going to do a partial lockdown, if you like, or partial restrictions for parts of the borough. I think there's a danger of increased confusion about the geography. So I think that's the first element around people where the borders are, if you like. Whereas everybody knows they pay the council tax to Calderdale. That's the geography. So I think that's the first thing, just from listening to what the public have said. The second thing is that one of what we've seen since the easing of the national lockdown is we've seen cases and outbreaks of the virus right across the borough. But what we've particularly seen is outbreaks in parts of the borough. So as you know, Halifax is the area of the borough with the highest rate at the moment. We have seen outbreaks in other parts of the borough, in the Lower Valley, in Todmorden and the Upper Valley, in other parts of the borough. What that's shown is that the outbreaks are happening right across the borough, and the people that are working in the places where the outbreaks happen tend to live in Halifax, if that makes sense. So what it's showing us is the connectivity in terms of where people don't just sort of live their lives in Halifax. They work not only in other parts of Calderdale actually, but we've also seen very strong connections with other neighbouring areas as well. So we've seen outbreaks in Wakefield and Kirklees, and then Calderdale residents working places, and we've equally seen the same. So we've seen that people work and people are connected in terms of where they spend their days. So they might live in Halifax, but they might go to work in Brighouse or Elland, or so for me it shows the connectivity. So for that reason, I'm not sure how effective restrictions in particular parts of the borough would be, because our people don't just spend the days where they live.
Okay.
Sorry,
can
I just come back on that?
Of course you can.
I think it's, personally as a councillor in a ward where that hasn't had a number of, well, any new cases in a number of weeks, you know, the argument from a resident's perspective is, why should I not be able to see somebody in my own home or garden because of a couple of areas in Halifax which they don't relate to, don't resonate with, other than that they pay their council tax to the same council, because of that, the double figures that are there on a weekly basis. So from that perspective, it would make sense to have a bit more of a sensible approach to areas where there are high spikes that are causing the rest of the borough. I mean, you stem from Todmorden to Brighouse, you've got, what is it, 15, 17 miles or something like that? They're miles and miles apart, but yet we all have to be in lockdown. And granted, you know, the spikes in other areas of both the Calder Valley and Halifax, but they are single digits, and they are usually down to, as you say, outbreaks in a specific workplace. So on the basis of fairness, I suppose, it may be a good argument to make that we should have postcode-based restrictions rather than a local authority-wide approach to it. But that's just a comment. I'm not expecting you to answer any of that.
Yeah, no, it's a good comment, Councillor Whittaker. Yeah, definitely. Councillor Megan Swift, please. Councillor Megan Swift, you need to put your mic on. Megan, you need to put your mic on. There we go.
You are unmuted. Thanks. Right. Can I just talk about volunteers for a second? Because we did this last time, and I don't know whether I've lost Sophie. Her comments still stand, but the ones I have is, you know, there are certain council staff who would be willing to volunteer, and they have offered and offered, and whether it is so complicated that we can't be expected to do it, but people are wanting to do as much as they can, and you know, not getting any further with it. And the other one is, I don't know whether it's a question or not, but since we stopped having the daily briefing, we seem to have an awful problem of people working out which set of figures to take notice of and which is correct, and they're coming from all over the place. Is there something that can be set up so they have a set of figures to go by, and at least then, you know, there's some idea what's going on, because between the confusion and people worrying, it's a bit much, really.
So the first question is a really good one, Councillor Swift. Yeah, and actually, some of our contact tracers are local authority volunteers. So people who work for the local authority who want to volunteer to help out, which is fantastic. So quite a number of people are either redeployed or people that are, and we've got actually people that are actually volunteering as well. So absolutely important that we give people opportunities to volunteer. We are in the process actually of, through the money the government's given us for our local outbreak plan, we are in the process of recruiting a coordinator to sit in the voluntary sector to sort of coordinate all the voluntary sector contribution to our work to bring COVID rates down. So I think that's a really important point. In terms of the data, it is really complicated. And I think I've been at this board before and said we're not getting any data, and if only we had data. And you know, we are now overwhelmed by data, and I do really agree, and there's quite a number of different indicators that sound like they're the same, but actually they're different. And one of the things that we're doing now is we've put a link on the council website to the government site that we use, that also includes maps of cases across the country, and we actually update the web content every week now. I should be doing it after this, writing it after this meeting, and we tend to do it on a Thursday night and then update the website on a Friday. And then what we tend to put there is the latest figures. And then what we also do is, I know that members get an email out from Robin at a weekend from our chief executive, and again we put the same figures in there. I think if we were going to update the data that we have on our website and that you get every day, we do nothing else. You know, we'd be taking a lot of capacity on doing that. So we think that if we update it once a week and we make it easy for you to find it once a week, that should help. But I do really sympathise around the complexity of the data, because I feel that very, very strongly.
So can I just check, as board councillors, if people, excuse me, if people ask, we can say you'd be better waiting until Friday morning when it's up to date, and that might stop people saying, well, it wasn't that on Wednesday, you know. So yeah, thanks, Deb.
Okay, thanks, Deb. So sort of, if we move on, thank you for the reports and updates, and so we've all got probably slightly different views as to where we should be in lockdown and the easement of lockdown, and certainly from Big House point of view, it would be nice to have some easement, but most important, getting rid of the barriers actually. But that's a different discussion, a different meeting. So thank you for that. Ian Baines, do you have anything else to, or would you like to give us a brief update? And if I can just remind members to just keep the questions short, then we'll get through the meeting a little bit sooner. Thank you.
Thank you. I think I'm going to do the bit that I always try and resist to do, which I think one thing that COVID has probably done, it's brought out the armchair scientists in all of us. So I think we've all got a view and a kind of idea about how we might be able to tackle this best. I think the bit that I'm thinking about in terms of social care is that we're not kind of focusing purely on delivering a potential plan for the second wave. We are still living through the first wave. And I think Debs has really articulated well that whether it's a workplace outbreak, a care home outbreak, or prevalence in communities, the virus is taking the opportunity to continue to transmit, irrespective of your background and your age. And that important bit about the increasing numbers of people between that age of 18 to 34 and then onwards, I think is a cause for concern. So our first line of defence has to be about, can we continue to keep up the efforts on testing? Because testing is one way we know about the prevalence, and then really respecting the bits around social distancing, the hand washing, and the wearing of face coverings become a kind of key line of defence against this. So that's my armchair scientist bit out of the way. I think one of the things that we have recognised is that since we've been an area of concern with increased intervention, I think last time we talked to you about our care home resilience plan, and you heard directly from some providers in a very moving way about how they were tackling that. And I think our providers have continued to double their efforts. We have not had issues around PPE, and we are seeing, you know, increased compliance with infection control, but we have started to see an increase in risks in care homes. And in part, that is about the fact that people do live in communities. And we can see some real evidence about where staff are testing positive, not through their necessarily contact direct with work, but the communities that they live in. So we have been working with our providers to kind of refocus our efforts to make sure that we still understand the importance of PPE, of infection control, the importance about how people might choose to socialise in their non-direct care time. So we've got some providers where we've kind of got a watching brief to kind of ensure that we understand what the pattern is. In order to be assured, we've had, at the height of the pandemic, had daily tactical command to ensure that we could put our resources to prevention and where there were outbreaks. So what I asked the system to do, and the system responded really well, is that we've stepped that back, we'd stepped that down to a kind of weekly process, because the numbers were really positive in terms of we were not seeing the number of outbreaks. But what we've decided to do is step that back up to daily, in order that we can respond rapidly if that's needed. Debs, myself, and in fact Martin Percy, who I think is waiting for one of the other items, we're now having regular Zoom conversations with our registered managers, just so we can work through some of the practicalities of what some of the guidance is doing, and try and support people to work through the guidance. Because a little bit like I think it's been said before, when you have a blanket approach to a situation, every single provider can think through a scenario that says, you know, when we weren't enhanced restrictions, the kind of ability for care homes to reintroduce visiting, was their ability to do that was often compromised by the physical space in which they operate in. So what we wanted to do is to be able to do some of that targeted conversation. I am still relatively assured that our providers and our support to them is on top of this, but I don't think we can relax until we really see that steady, not just a stabilisation of the figures, but start to see that figure decrease.
Okay,
I think I'll pause there, given the time.
Yeah, no, thanks, Ian, for that. Councillor Clark, you have a question.
I do. Well, thank you, Chair. This is about the number of tests that are carried out locally. Do we have any numbers of that? And then going to contact tracing, do we know the number of contacts? Obviously, it's very early days yet, but and what proportion of that is successful? You know, if we have 10 contacts to trace, do we only trace 8 of them? I know that it's done nationally. Is there any link between that and the local testing? Do we know if it becomes closer to 100% testing, tracing? Do you understand what I'm saying? Anybody?
Yeah, I think that's probably going back to the conversation that Debs was having around broader testing. But just to assure you that our ability to test in care settings, again, like an attempt to try and step up testing in our broader community, we are continuing to see an increase in regular testing of staff and of residents. So in terms of the care setting, we know that that's on, we are continuing to see an increase of take up on tests. But I don't know if Debs wants to come back and just say a little bit more about the broader testing issue.
Yeah, I do. Just around 4,500, give or take, more or less, around 4,500 Calderdale residents are tested in a week, usually. As I say, it's been higher than that. It might even be a little bit lower than that at the moment. In terms of the it's too early, you're right, Councillor Clark, around the local contact tracing. We know that the between half and 2/3 of the contacts through the national service are contacted, if that makes sense. Too many contacts in that sentence. Yeah. Between a half and a third, depending on how complex they are picked up through that.
Thank you. I was just thinking of something maybe to think about in the future. I know it's too early as yet. Thank you.
Okay, anybody else indicating to, yeah, Councillor Megan Swift, so I'm just looking at the screen as well.
Right, I'll push it in front of Colin. The safeguarding document, if people look at page 3, it's got all sorts of information on there in big print, in, you know, like a table, and where somebody I don't think would read the whole document. I think they could make the most of page 3 from there. It's worth having a look at.
Okay, thanks for that. Councillor Hutchinson, please.
Can I ask Ian about whether there is regular scheduled testing of all staff coming into care homes and home care, as he made the case, as the numbers are relatively high in the community, there is more of a likelihood that the workforce will be exposed to infection outside of their work and bring it into the care home. So we do need to have a regular scheduled testing program for all staff. I was rather surprised that Debs had said that there were capacity issues around testing, because I think the latest figures I've seen from the Department of Health is that there are about 300,000 capacity for tests nationally, but only an uptake of about 150,000, which would suggest that there should be ample capacity to get these tests done.
Councillor Hutchinson, I think it's a really important question. So I think I'm probably more confident that we have got a schedule of regular testing in residential and nursing homes. And you'll be aware that there was an announcement about that they think they won't be able to, the government won't be able to fully roll out regular testing until September. And you know, that is disappointing, but I understand the reasons why that's not being possible. So I think I'm relatively more assured about the level of testing in care homes. I do know that some of our providers are not unlike what Debs was saying, is that sometimes the delay in getting results and sometimes the dates of delivery aren't as consistent as we would like. So there's more work we need to do on that. But we do know that the uptake of regular testing is certainly borne out by the numbers. I think we are seeing more home care workers being tested through the testing system. But I think increasingly we need to see that become on a more regular basis. We probably need to think through a local strategy about how we focus on social care workers that work in non-residential and nursing settings. Certainly, if we think about community prevalence, then the way in which home care is delivered increases the likelihood that in the community, home care workers between visits could potentially be exposed. So I think it's a really important question that you've raised, and I think it's one that I know that we think we will need to kind of think through how we deliver on that.
Excellent, thank you both of you, Ian and Debs, for giving us the a comprehensive update on those items. I think we're going to move on from that. I think we're getting regular updates via websites and information and elsewhere as well, so that's really appreciated, and the communication once again spot on in terms of emailing and including us as councillors, local councillors. So continue the good work on that. So we're now going to move on to item number 6, which is an integrated approach to procurement. So we've had the report. Do we need to invite some other people?
Yes, I'm just going to bring in Martin Pearce, Chair, and I believe he's going to present along with Jill.
Okay, just bear with members whilst we I think we've got Martin in now.
I think we're good to go.
Yeah, good. Right, okay. So we've got item number 6, which is an integrated approach to procurement. So we've had the report. So Martin, do you have anything else to add to the reports, first of all?
Sorry, Chair, I was just, I'm new to Zoom. We use Teams most of the time, so I've just had to get used to some of the bits and pieces. So I'll mute for a bit. I think what we've tried to provide is is a brief update as to where we are, some background as to the integration journey that we're both on, a bit about where there are subtle differences in terms of the way we approach procurement, mainly around the particular requirements that the NHS have around competition and choice, and then also the fact that we have worked together in the past, and where that's worked really well, it's where we've been able to align our strategic commissioning intentions at an early stage, and then that has followed through to procurement process as part of that commissioning cycle. And in terms of the next steps, I think the integration stroke alignment journey that we're both on, I think, has taken quite an increase in pace over certainly the last 12 months, and we are now looking at the way in which we can make it more of a default position that the first thing we do is look at how we work together as a first point of principle, as opposed to only when it touches. I think it's a way of describing that.
Yeah, no, thank you for that. So can you perhaps give us a bit of an insight as to where you see the next few months working with Calderdale, and where does that expand, and what involvement do we have as a Scrutiny, basically?
Yeah, I think what we are working on is, I think historically we've shared our, well, to use the jargon, procurement pipelines. You know, those contracts that we think we're likely to seek to procure over a period of time, but we've never really aligned them as such, and it's been the obvious ones where we've picked out joint potential processes, and even when we've done that, we've never really kept a pace of the various changes to those commissioning intentions in both places. So it's more about getting closer in terms of having essentially getting together more often to have a specific agenda about, well, what are you working on and what can we work on together? So there's that in terms of having a dedicated group. Probably better alignment in terms of the integrated commissioning exec, because that's been operating for a number of years now, and it's more about making it real and more task-based. So first thing to do is for us to both share our pipelines and then understand realistically which ones we can work together and do it early, and that's the next steps really. So what we've worked, the summary, we've worked together before, but I think we need to change the way in which we work with each other to make sure that's more aligned in future.
Yeah, okay, excellent, thank you. Councillor Hutchinson, you have a question.
Yeah, thank you, Chair. There's two, if I may, but the first one is, thank you, is that when the examples that you gave as to joint approaches to procurement in Calderdale include the personal care and support at home. The review concluded in 2018, but the report refers to we will offer guaranteed hours, will be supported by a robust quality assurance form. When will this actually come into force? And have there been delays in this approach as a result of the joint approach to procurement, and how can that be improved?
I can certainly answer the second part in terms of the joint approach. I think that's, I suppose, when I was saying that although we're aligned, sometimes we've only worked together when we have certain touch points. I think this is one of the areas where working together going forward, I think we're a lot closer aligned in terms of understanding who we share in terms of who we use within the market and what that looks like. So certainly we've now got things like joint steering committees in terms of the care home market. We're both understanding what that means to both CCG and the local authority. In terms of the first question, I think that's probably more of a question for my local authority colleagues.
Okay.
Ian, would you like to come back on the first part of the question, or do you want to?
I'm going to suggest that Jill, who's much nearer to the procurement, kind of takes the first part of the question. Jill, would you like to respond?
Yes, certainly. So in terms of when it will come into fruition, the planned go live date now is the 2nd of November this year. It would have gone, it was planned to go live earlier this year, but obviously there's been delays more so linked to COVID than linked to the integration issues. So we now have a plan in place where we are commencing the mobilisation for the new personal care and support at home, with a plan that it will go live at that time.
Excellent. Thank you for that
clarification. The other question I had was that not all, when services are procured, they don't always work the way that you'd intended and the way that the contracts that underpin that procurement actually set out. And overall, there's been a pretty weak approach to enforcing the terms of those, the quality aspects of contracts, even assessing the quality. I just wondered, with this joint approach to procurement, how are you going to decide, how are you going to sort out issues of delivery on these contracts?
Wow.
Yeah, I think you are right. There have been occasions where what was intended from the procurement hasn't been delivered, and some of that has been down to enforcement, I suppose, in terms of the contract conditions. I think what we seek to do is learn, and where we think that the compliance with the contracting conditions has been weak, and we make sure that what we're asking for is very clear, and the implications of not complying with that are also clear. And then it comes down to being diligent and making sure that we apply them. So I think you're right. We have had experiences where things haven't gone as well as they should have done, and all I can say is that we learn by all those things to build into the next one.
Good, excellent. Councillor Greenwood.
Sorry, I wasn't quite ready then. Yes. Has funding in the past been historically allocated to specific services and ring-fenced for that particular need? Under the new procurement strategy, will this deliver a different service where possibly we're always trying to give improvement and value for money? Will this help in this area? And can I also ask, it's a bit linked to that as well, you know, currently hospital funding for excess trim point, where there's no appropriate social care, you know, can we work on the fact that this funding could be transferred to social care and alleviate the bed blocking in the trust, if that makes sense? Thank you.
Yeah, I struggle to hear some of it. I suspect it's my connection. I think in terms of the funding, I mean, that's a slightly different issue in terms of how we fund things and the ability to defund certain services and fund others. I think part of the ongoing approach, or the developing approach around the alliance concept, where you bring groups of providers together to work together within a certain space, is probably going to be one of the more effective ways of doing that, where those group of organisations come together to partner, understand where the work needs to be done and where the current money flows are, and hopefully that will then engender some transfer of that resource. But I don't think there's it wouldn't be right to say there was a simplistic way of saying, right, you know, we're going to take the money out of the acute contract and put it somewhere else. It's a lot more difficult than that. But I think the alliance principle and the partnership principle, in terms of moving together as a group of providers, I think offers more opportunity to spread that resource where it needs to be.
Ian, do you want to come back on that? Yeah.
I think at the heart of Councillor Greenwood's second question, I just want to just clarify where I think we are in Calderdale in terms of performance. So obviously during COVID, NHS England suspended the need to report on delays transfers of care. But what we have been doing locally is continue to monitor the system performance against delayed transfer of care, and also about the length of stay that someone experiences. So that idea that have we got a ready supply of social care to appropriately support people in the right setting? And actually our performance continues to be really strong on both DTOC and length of stay. Obviously, we're not reporting that because there's no requirement to report it, but we are seeing really strong performance on reduction of length of stay, which does suggest that to challenge that concept that that social care is contributing to delays and potential bed blocking doesn't appear to be a current issue. I do think there are some issues about how we address in the long-term procurement plan the sustainability of social care, because I think everyone now in the system recognises the important role that social care, both in terms of residential nursing home and home care, has played in supporting our acute colleagues in managing a reduced occupancy during COVID. So I think there is some commitment across the system to think about how we can ensure an ongoing resilient social care, and that will need to be reflected, I think, in future procurements.
Excellent. I'm going to move on to Councillor Lee.
Thank you, Martin.
Thanks, Chair. Sorry about my clumsy spelling there. Question for Jill and Ian, please. This plan was clearly written before COVID, so some time ago. And we all know what's happened during that time. And I'm just wondering if it's changed and how, in the light of recent experience with COVID and huge procurement problems that have been witnessed throughout the country, and what lessons have been learned, and will the new plan be materially improved given the light of the COVID experience?
Who would like to say? Martin, would you like to come back on that? Or Ian's probably best on that one, perhaps.
I'll have a go, because I think Councillor Lee's question is really important, and I think Jill's already highlighted the example of the personal care and support at home contract, where we had we'd almost got to the point of the procurement process where we were looking at the award of those contracts, and then what you have is a period of mobilisation where you move from one contractor to another. Clearly, COVID really impacted our ability to do that. So I think there is some, and I think it was right to not press ahead, because we couldn't do some of the important work to ensure that people's care could be transferred safely. I think one of the things, and clearly what we had to do, is deploy a lot of staff who work in our commissioning function, who work in our contract and quality functions. And this was the same for the CCG. We had to move them from what often can be described as kind of back office functions to support our frontline effort to protect our most vulnerable people in the community. So I think it has had an impact on our ability to implement commission decisions, procurement decisions that were already made and mobilise them. And we've had to seek, in some instances, an opportunity to delay some procurements in order that we could get the resources back up. Whilst I think we've had a conversation tonight about still being in the middle of the first wave, I think that we have got some recovery plans about how we can regain some of the lost time and ground on some of those. I do think it will mean we're going to have to think very differently about our approach to procurement going forward, and that we kind of need to think in a post-COVID world, how might we approach creatively procurement that isn't reliant purely on face-to-face evaluations and transfers. I think there's a way in which we might be able to do this in a more virtual way. So I think there's an important way some important lessons that we need to learn, because I mean, I usually am quite an optimistic person, but if we do get a second wave, what we can't be held hostage to is not being able to progress yet again quite critical procurements.
Yeah, thank you for that.
Sorry, Chair. Can I add? I think the impact certainly within the CCG has been that delay. So pre-COVID, where we'd anticipated that new services would start from, say, the 1st of October this year, then effectively what we've had to do is extend those current contracts and put them back until the middle of next year. So it has had that impact in terms of some of the practical extension of contracts that we've had to do.
Thank you for that. So, Councillor Metcalfe, would you like to make a comment?
Yes, thank you for letting me contribute. First of all, I really do welcome this report, and obviously it is vitally important that we, with both the CCG and the Council, do move forward on this integrated agenda. I just want to comment briefly on what the intentions are at the end of the report. Saying by the end of this September, this joint procurement group formed, bringing together appropriate colleagues, etc. Not sure when the report was originally written, but it seems a tight agenda does that. Is it still realistic that that can be achieved in the timescale that's set out in the report? And just how is that going to be brought about? Just what's the mechanics to bring that report forward? Who's going to be deciding on that, on the joint procurement group? And the second part of that resolution, the joint approach to Calderdale Place, can that just be briefly expanded just to see just how that's going to be worked through, and what kind of timetable is that envisaged? And just finally, Integrated Commission Executive, that body been running now, that board been running now for a number of years. It's mentioned very briefly in the report. I just want to, it hasn't been meeting in the last few months because of pressures in other areas, and working up various plans to come forward to it. It's been worked up by CCG and the Council. I just want to just want to know just how that the role of ICE is going to fit into all this work that's been envisaged here.
All right. I'll try and answer some of those, certainly. I think you're right. By the end of September is tight to have a fully fledged plan. I don't think that was the intent. The intent is to get the group up and running by the end of September. I think what that does, it builds on an increasing contact between colleagues, between the CCG and the local authority, the council, to almost formalise that increased level of contact into a formal group. I think the joint approach, I think from a personal perspective, I think there's a number of ways of describing it, but I suppose if you imagine like a Venn diagram, then at the moment we tend to get involved with each other when we can see obviously that things touch. What we're proposing is that it almost becomes that consideration of whether or not we can possibly do something different or something together is almost the first thing we consider, as opposed to we go through our commissioning intentions in both places and then decide, well, actually, at the end of that, is this something we can do with the local authority or vice versa? So it's more about shifting the mindset, if you like, to say, well, actually, the first question we'd ask, can we do this together? I think that will then bring a richer plan in terms of the potential for joint commissioning and joint procurement. In terms of ICE, from my own personal perspective, I think ICE will have a role to sort of hold the ring on certainly the joint commissioning intentions and the way in which they're being delivered, and almost hold the procurement group to account, saying, well, you know, what are you doing together? Where are we in that trajectory? So I think ICE has a key role to play in this, because I think that's where the most obvious coming together of the strategic commissioning intentions happens.
Good. I've just got two more councillors, and I'd like to bring it to a close because we've got another item to go through as well. So I'm going to bring in Councillor Barnes.
I think my colleagues have asked some very strong and pertinent questions on the report, and I thank them for that. I want to look forward, and I think what this does, it gives us the baseline. And I think going forward, I want to see some more meat on the bone, some more specifics, and actually going through some of these joint initiatives, integrated procurement, and actually have a look and start scrutinising those and start having a look at it. Because going back to Martin's point, I think without that change of mindset, that change of mindset is important to bring it to the first point, the first question. So going forward, and it was one of the points in there, I think I would like to see this come back with actually some specifics on it, if that's at all possible.
Yeah, Councillor Vance, I think that's what I was going to come to a conclusion in terms of the next step forward. So I'm going to bring in Councillor.
Sorry, Chair, for stealing your thunder. Sorry.
Hey, I don't mind at all. Great minds think alike. But I'll move on. I'll bring in Councillor Clark.
Has she gone?
Thank you, Chair. I'm here. I would like reassurance that the procurement would not sort of take place in isolation with a procurement group, meaning that people that are relative to the type of product or service that you would be providing would be brought into, maybe co-opted into procurement. I'm very worried that we end up with something that's not quite what would be the best. A bit like the contract for tests, and nobody told them that they had to report it at the end. You know, I don't want that sort of thing to end up.
Yeah, no, I think I understand where you're coming from. I don't think it's the intention that the procurement group will determine what, you know, the procurement is. It's more about understanding what the timelines are and what the projects are in the timeline, and then making sure the resource is there. With any procurement process in both places, what you tend to do is bring together a team that is appropriate for that particular service or commodity that you're buying. So that won't change. It's more about the overarching understanding of what needs to be done over a period of time and making sure that the resource is in the right place. It wouldn't be about an insular way of running procurements. It's not about that. It's more about the overall management of both of our procurement plans.
Okay, thank you.
Excellent. So I'm going to bring it to a conclusion.
Sorry,
Ian, go.
Howard,
Yeah.
sorry, I do apologise. I realise you want to move on, but I think Councillor Clark has just raised a really interesting point, and I think one of the things I think we are attempting to build in to any future kind of commissioning and procurement is to ensure that the expert by experience voice is understood through that process. So, for example, through the personal care and support, we engage with a group of people who were consumers of personal care and support at home to try and help us understand, in terms of the spec, what it is that they would want out of a good home care provider. And I think we've got some opportunities to be really creative about how we have building that experience and that specialist expertise into the procurement process. I think it's a really important point. Well made.
Yeah, no, it certainly is. Excellent. So I'm going to draw to a conclusion in terms of, I know you said you're going to set up a joint procurement group, and I think we should concentrate on some of the terms of reference following from that group being set up. So I think as a scrutiny panel, I think we'd like to see what the terms of reference are moving forwards, a bit of the work plan, what it's going to look like in 6 months' time, and you know, so we can actually properly scrutinise to ensure that actually, you know, you're not missing any integral parts, and certainly communicating with all elements. So I think everyone's contributed some really relevant parts. I think it is going to look different in 6 months' time in terms of what the integration looks like, but we're very keen to welcome you back and reporting exactly what plans, and including a potential 5-year ahead, looking forward. That's far ahead as well. So thank you for reporting on this. If all members are in favour of that, we'll welcome you back and move on, if that's okay.
Okay.
So thank you, Martin, for coming in and joining us on that. So we've got item number 7, which is a Calderdale Safeguarding Annual Report. We need to bring somebody in. Jed's welcome, Jed. We've got him. Right, so we've had the safeguarding report. So Jed, anything to really highlight from the report? We've seen the report, so is there anything to add to the report or to highlight on that?
Good evening, and thank you for the invitation to the meeting. And I think a few things, if I may, Councillor. It may seem obvious, but to point out, this is the report for 2019-20, so up to the end of March this year. So just really before the COVID period really started. So I think it's relevant to understand the report from that context, in terms of this report was about a time when, if I dare say it, it was normal business. So there is that context. Clearly the report sets out in the front end the executive summary in terms of the activity of the board against its strategic objectives, and then goes a little further in terms of some detailed activity, particularly draw attention audit activity that partners have undertaken to give the board assurance, and the development of the performance function. I think it would also be useful potentially to take the opportunity to just update a little bit in terms of the board's current activity or approach. So I think once the COVID was clear of the impact, I took a decision to reduce some in order to enable professionals to deal with their frontline duties more effectively. And we therefore reduced some of the activity of the board in terms of some of the working groups and certainly some of the audit functions, because they rely heavily on operational partners in order to do the work and deliver. And clearly at this critical time, certainly in the first few months of the COVID crisis, it was important that those professionals were allowed to deliver frontline activity. We have now all of the working groups. Board meetings have now restarted, albeit virtually, as with pretty much all meetings. And so the board is now operating in its new virtual form, having activity for a little while in order to allow people to concentrate. So I just thought it was helpful to let people know of that. I'm sure people have had the opportunity to read the report. I won't go through and read it, but I'm very happy to pick up any questions if there are any. Thank you.
Yeah, no, thank you, Jed, and certainly thank you for your hard work as an independent chair. It's very much appreciated from the adults side of things. So, Ian, do you want to make a comment? Let me just take you're on. Sorry, you're on mute.
Yeah, I made that cardinal sin of not pressing the unmute button. I do apologise. I kind of just want to take time from the scrutiny board and important scrutiny work just to acknowledge that Jed McManus has been our independent chair since we became a statutory board. And actually, in terms of his tenure, he's done the maximum tenure that he's done. So this is in fact one of his last kind of acts as independent chair. And so we're on with recruiting a new independent chair. They're going to be difficult shoes to fill, but we have got a very viable and really lively shortlist of candidates we'll be interviewing next week. But I just want to pay tribute to Jed, because he's steered us through some very difficult times. He's really created a safeguarding board that's allowed us to really focus on protecting and understanding the safeguarding issues across Calderdale as a system. So I didn't want to miss the opportunity just to pay my own tribute, but to thank him on behalf of the whole board in terms of a safeguarding board that I think we wouldn't have got as far as we had if we hadn't had a chair like Jed. So I'd just like to say thank you to him, and I'll leave you to do your scrutiny.
Fantastic. Thank you, Ian. If we can just mark that on record, Carol, I'm sure you will, because your minutes were excellent last time, so I'm sure you'll mark that as well as official thanks from the board. Right, Councillor Greenwood, it looks like your question's been answered. Is that correct, or do you have a separate question?
Thank you, Chair. Yes, it had, because reading the very comprehensive report, it was in my mind all the time, but what was the dateline? I suspected it probably was pre-COVID, and the next report will be very, very interesting, because it will reflect a very different view on everything, won't it, as we all know. So this is a valuable document, and it is, because it's the pre-COVID, and then we'll get all the stats from what happened following that. So yes, the question's been answered.
Excellent. No, I didn't want to miss you out. So Councillor Hutchinson.
Thank you, Chair. I mean, obviously, there's been a lot of thought given to training needs and working together on the safeguarding issues. But I draw the board's attention to the minutes of the meeting of December 2018, which was the last time we discussed one of these. And members, it set details that members commented on the following issues. The report was long on detail of structure and procedure, but it was felt that it lacked clear sense of what particular issues the board had dealt with over the year. What were the most pressing concerns requiring attention in the coming year? And were we in a better place now than we were 12 months ago? I get no sense from this report as to what keeps the Director of Social Services awake at night worrying, and how we're making progress in dealing with what are the main themes in safeguarding that we're trying to actually deal with. I just can't make anything out from this report from that point of view. So I just wonder whether we're actually scrutinizing the right report under these circumstances. Is there another report that actually has the details of what these themes are that we could then look at and explore through the scrutiny process?
Jed, do you want to come back on that?
Yes, I'm very happy to come back on that question. And I think we are caught between two stools with the report that we try to make accessible in terms of not providing too much information, but at the same time give enough to give a flavour of things. If we've not quite hit the mark, then we accept the feedback. Underpinning these reports are very detailed business plans which go into the work, the targets, etc. of the board, and it would be entirely possible to discuss those at a different time. Councillor Metcalfe, of course, is your representative on the safeguarding board as a permanent member of the board, and has regular access to all of those documents. But certainly, it would be possible to come back with more detail on particular points.
Okay, thanks for that. Ian, would you like to come in back on that as well, please? Yeah.
I won't take too much time talking about what keeps me awake at night, because quite a lot of things do. I think the important bit to reflect on is that there's a statutory requirement to have an annual review in the form of a report, and that it has to be formally reported statutorily to HERE and the Health and Wellbeing Board. I wonder, and I think Councillor Hutchinson's observation is quite critical, I wonder whether as you think about the future work plan, we pick up some of the themes that Councillor Hutchinson suggested about understanding the work underneath this. Obviously, the report is not a report purely on adult social care in terms of the local authority, but our approach to adult safeguarding across a very complex system. But I wonder whether some of the meat of the conversation isn't just purely at the review, the annual report review, but understanding some of the key challenges and how we're approaching those challenges across the social care partners. And I wonder if that's where you probably get a really healthy discussion and debate and understand some of the challenges purely than just a report that covers a retrospective year.
I think that would be most useful. We know we have to receive this report on an annual basis, but it would indicate a strong feeling that we take this subject very seriously as a board, and we very much welcome the opportunity to scrutinise some of the details of. Thank you, Councillor Hutchinson, for those suggestions, which we'll include with the work plan. So just
Thank you, Chair.
minutes, if that's okay, Alex. That's on that. Right, Councillor Lee.
Thank you, Chair. First of all, thanks, Jed, for your work as chair of this board. I'm sure it's been a labour of love, and so many thanks to you. Now, I agree with all of the points that Councillor Hutchinson made. I think a lot more detail is required, and I think that Ian Baines has probably answered this, but I think we need to get down to the nitty-gritty rather than an annual report, which is generalising and not giving us any detail. So I agree with that observation, and I think the chair's already said we'll do something about that. But my question again is very similar to the last agenda item, that in the post-COVID world that we will be living in when we are post-COVID, what, in the light of what's been happening, and we've heard of some terrible stories of domestic abuse, I know in very unusual circumstances because people have been locked down in a strange way. But have we learned anything from this? And will we be able to improve our performance in light of some of the terrible things that have been happening?
Perhaps it's a question too early at this stage, perhaps. You know, it'll come to light, I guess, in months to come, which is why I think it's important that the matter comes, you know, back as a scrutiny item, that we're picking up some of those issues, in my opinion. But if anyone else has anything to add to that. No comments well made. So I think thank you, Jed, once again. Very much wish you all the very best for the future, whatever that may be. We hope to see you in a different format, perhaps. Welcome back to the panel. So I'm sure we'll welcome that. And moving forward, to recommend to the panel that actually we receive more detailed information and scrutinise some of the elements. You know, likewise, like Councillor Lee's mentioned, that we can do. Mike, do you have a suggestion as well? Mike Lodge.
Yes, thank you, Chair. I was just reflecting on the last few minutes of the discussion, and one of the constraints of a shorter meeting in the evening is about getting into the detail, and whether this might be something that, as a board, you might want to think about, perhaps having one. We talk about scrutiny in a day, but maybe scrutiny in a half day, and perhaps get some information and advice and perspective from some practitioners, as well as Ian and the safeguarding side, and perhaps 4 or 5 of you meet for 2 or 3 hours and have a real go at this in the autumn sometime.
Yeah, no, that sounds like a great idea. So we'll incorporate those into the work programme at a future date. So thank you, members, for that particular item. I'm going to now move on to the work programme, which has been circulated. Just to let you know that I plan to have a meeting with Alex and Mike and Megan to discuss the next few months to put some meat on the bonus to some of the items that are on the agenda. So unless anyone else has anything to add to the work programme, Mike, would you like to come in on that?
Yeah, thank you, Chair. I was just going to, one of the things that we sort of dropped off the wording in the agenda, but perhaps we should do from time to time, is to report back on the activities of the joint committees. And Councillor Hutchinson and Councillor Councillor Stephen Baines, were at the August meeting of the West Yorkshire Joint Health Scrutiny Committee. And I just wanted to alert you to one item, which was a discussion about health inequalities, particularly as it related to BAME communities. And one of the outcomes of that discussion was that Councillor Hayden from Leeds, who chairs that committee, is going to write to each of the chairs of the six scrutiny boards in West Yorkshire and North Yorkshire. And she will be suggesting that there'll be an item at the November meeting of the Joint Committee on Health Inequalities, and she'd welcome an insight from each of the 6 places about their approach to health inequalities. So that may be something that you might want to think about putting in September or October as something, so that you can have a sort of an agreed feed into that discussion when it takes place later in November.
Yeah, no, superb. And the other element is that we've had a calling a notice in relation to the joint scrutiny for the Kirklees and Calderdale in relation to the reconfiguration. So we'll give you an update as and when with that. But other than that, does anyone else have anything to add to the work programme? So we will discuss. I'll be meeting with officers and Megan to go through that to outline in more detail the next few months. So we'll take that as read. And well, thank you all for your precious time this evening. It's been an extremely informative meeting as always, and very much welcome everyone's inputs. I'm always here at the other end of an email. If you need to email me any questions or you have any issues that you'd like me to raise on the scrutiny panel, then I'm more than happy to take those ideas and comments on board. So thank you, officers. Thank you, members. I will formally close the meeting. So thank you.
Thank you, Chair.
Thank you, Chair.
Thank you.
Yeah.
Night, everyone.
Thank you.